Hi, I'm a pediatric emergency physician, and today I'm here to help you manage your child's fever with confidence. In this module, we'll cover 6 key questions from what fever is to when it's time for the ER. 2 quick caveats. First, this applies to otherwise healthy, vaccinated kids over 6 months. Infants under 2 months with a fever need to be seen in the ER urgently, and infants between 2 and 6 months, while less urgent, should also be seen by a medical professional in a timely manner, particularly if there are any concerns. Second, this is not a substitute for professional medical advice, diagnosis, or treatment. Never disregard professional medical advice or delay in seeking it if you're concerned. Now that we have that out of the way, let's dive in and take the worry out of fever. In this module, we'll address the following subjects. 1. What is a fever? 2. Why do children get fever? 3. Why is the fever so high and does it matter? 4. What about febrile seizures? 5. To treat or not to treat? 6. When should fever prompt an ER visit? And 7. A bonus topic, things to know for an ER visit. Now that we have that out of the way, let's begin.
Question 1. What is fever? Let's start with the basics. Fever is a temperature over 100.4 degrees Fahrenheit or 38 degrees Celsius, taken rectally or orally for older kids. What about those cool new forehead or no-touch thermometers? They're less reliable, so stick to rectal for babies under 3 months or oral for kids who can cooperate. Fever is the 6th most common reason for visits to pediatric emergency departments and a source of considerable worry and stress for many parents. A fever almost always means the child has an infection, which in children older than 2 months who are vaccinated, is almost always a viral infection that is self-limited, meaning it will go away on its own and is not dangerous. In the developed world, in otherwise healthy, vaccinated children, serious infections, such as meningitis or blood infections, are very rare. Fever also can cause children to have slightly more rapid breathing and an elevated heart rate. These are all normal responses. But here's the key thing to know. Fever itself isn't an illness, and it's not dangerous or harmful on its own. In fact, it's your child's body fighting an infection. Question 2. Why do children get fever? So why does fever happen? It's your child's immune system turning up the heat to fight germs, usually something like a cold virus. Higher temps slow down microbes and boost your child's defenses, like white blood cells. That's one reason why kids may feel achy or weak. It's the body working hard. Vaccines help prevent the worst infections, so keeping shots up to date means fewer fevers to worry about. There are no vaccines, however, for the common cold viruses and the viruses that cause stomach problems, which is why those are still very common. To summarize, fever is a sign that your child's defenses are kicking into gear.
Question 3. Why is the fever so high and does it matter? Ever wonder why kids get such high fevers? And so often? Their immune systems are newbies, super eager and reactive, which is why they get very high fevers from harmless, simple cold or stomach viruses. In addition, it is often the child's first time encountering these viruses, so the body's response is heightened. Adults and older teenagers, however, usually don't get fevers from colds and are less likely to have such high temperatures as our immune systems have typically encountered the virus before and take control of the infection quickly. But does a sky-high number mean trouble? Not usually. Studies have shown that, particularly outside of the newborn period, the height of the fever doesn't strongly correlate with increased likelihood of severe infection or bacterial infection and does not, by itself, pose a reason for concern. And no, it won't cause brain damage or any other adverse outcomes, though this is a common belief. The body's too smart for that and won't create a temperature that is harmful to itself. So don't panic over the number. Focus on how your child's doing. Question 4. What about febrile seizures? About 2 to 4% of children with fever will get a seizure. We call these febrile seizures. These are scary to see, but usually harmless. Treating fevers does not appear to prevent febrile seizures from occurring. This is true even if your child has had febrile seizures in the past. However, if your child has already had a febrile seizure during this febrile illness, then it is possible that treating the fever may reduce the risk of another febrile seizure happening during this illness. If it happens, keep them safe, lay them on their side, clear the area, and time it. Over 5 minutes? Call 911. Otherwise, if it resolved on its own and your child returns to normal after a little bit, check with your doctor after. Most kids outgrow these with no lasting issues. 5. To treat or not to treat. Parents often worry about keeping their child's temperature normal. In fact, a survey found that 50% of parents consider a temperature below 100.4 degrees a fever, which it's not, and 85% wake their sleeping child to give fever meds. You don't need to do that. If your child is resting comfortably, let them sleep. Sleep is healing. The American Academy of Pediatrics backs this up, saying, "Fever, in and of itself, is not known to endanger a generally healthy child." While the fever itself is not dangerous, it often causes the child to feel unwell. Fever is commonly accompanied by muscle aches, headache, and weakness, which can all cause the child to be uncomfortable and miserable. As a doctor, I only recommend treating fever with medications like acetaminophen or ibuprofen, commonly known as Tylenol or Motrin, if your child is uncomfortable. For example, if they're fussy, not sleeping well, complaining of body aches, or just seem out of sorts, that's when I'd suggest a fever reducer. But here's the big point. I don't treat fever just for the sake of bringing the number down. The goal isn't to hit some magic, normal temperature. It's to help your child feel better. Simply put, treat the fever when the fever bothers your child, not when it bothers you. Remember, fever is helping your child's body fight off the infection. If you do decide to treat, here are a few tips. First, antipyretics are dosed by weight, not age, so know your child's weight and consult the weight-based dosing chart we provide. Most parents accidentally underdose, which means the medicine might not work as well. Second, don't expect the fever to disappear completely. Depending on how high it is, the medicine might lower it but not eliminate it, and that's okay. The fever will likely come back after the dose wears off if the infection's still around, and that's normal too. Oh, and one more thing. As already discussed, some studies suggest overusing fever meds might make your child contagious for longer or even extend the illness. More research is needed, but it's something to keep in mind. Most viral febrile illnesses in kids are self-limited, meaning they go away on their own and aren't dangerous as long as your child looks well and stays hydrated. It's totally normal for kids to lose their appetite when they're sick, so don't stress about that. If they're playing, drinking, and acting like themselves, that's a great sign.
About how fever itself isn't usually a big deal, meaning it's usually a viral infection and there's not much to worry about or do. But now let's get to the part every parent wants to know. When should you worry? When does a fever mean a trip to the ER? Or at least a call to your doctor? Let's walk through it step by step. Here's the thing. I don't focus just on the fever number. It's the symptoms around the fever that tell the real story. For example, if your child has a fever and isn't drinking fluids or making wet diapers, the dehydration is what worries me, not the fever itself. Or if they're having trouble breathing, like really struggling, not just breathing fast from a fever, that's the red flag. As we discussed, fever can make kids breathe faster, and that's normal. If you're unsure, try giving Tylenol, wait a bit, and look again. If they're still working hard to breathe, that's when we need to check it out. Count those wet diapers to track hydration. Modern diapers are amazing at soaking up urine, so even a slightly wet one might mean more output than you think. Don't stress too much, just keep an eye on it. There are a few specific situations that should raise your antenna. If the fever lasts beyond 5 days, that's a signal to get it evaluated, especially in young babies or toddlers, where we need to rule out rare conditions like Kawasaki disease, a treatable inflammatory condition. Also, watch for a sudden worsening of your child's condition or new symptoms popping up, like a rash or pain somewhere specific. These could point to a bacterial infection or something else we need to figure out. Lastly, if your child has a history of urinary tract infections and isn't having symptoms of a cold, it is probably worth getting their urine checked. For newborns under 2 months, any fever is an ER trip. Older kids, fluids, hand washing to stop spread, and trust your gut. Most importantly, pay attention to how your child's acting, not just the thermometer. If the fever's still hanging around after 5 days, or if anything feels off sooner, follow up with your doctor, or come see us in the ER if it's urgent. We're here to help you sort it out. Otherwise, keep fluids flowing, count those diapers, and trust your gut.
We've covered what fever is, when to treat it, and when it's time to head to the ER. But what happens when you get there? Let's talk about some key things to know for your ER visit, straight from my experience, so you can feel prepared and avoid some common hiccups I see parents run into. First, if your child's uncomfortable, don't hesitate to treat their fever or pain before you leave. A dose of Tylenol or Motrin, measured by weight, can make the trip less miserable. But here's a common mistake I see: underdosing. Parents often give too little, so it doesn't help much. Check our weight-based chart to get it right. Also, take their temperature beforehand with a reliable thermometer, rectal for babies under 3 months, oral for older kids. That number helps us figure out what's up. Oh, and pack smart. Diapers, formula, a change of clothes, and a favorite toy or blanket. Trust me, that comfort item can be a game changer in a busy ER. Next, bring the info we need to help you fast. I can't tell you how often parents don't know the last dose of medicine or forget allergies. Jot down recent meds, doses, and any reactions, plus medical conditions, surgeries, or specialist names if your child has them. It speeds things up and keeps your child safe. And while you're at it, don't assume we'll slap antibiotics on every fever. Most are viral, and overusing antibiotics fuels resistance, as well as many side effects, ranging from unpleasant to dangerous, that you do not want for your child. We'll figure out what's needed together. The ER's for emergencies, and triage means the sickest kids go first. If it's not life-threatening, you might wait. I know it's tough, but it's how we save lives. Knowing that can ease the frustration.